Hey everyone, excited to be with you today. We have a special guest to interview. Her name is Angie Wetli. She is experienced in 25 years in the medical field, including 18 years as a registered nurse, 7 years as a family nurse practitioner. She has specialty training in functional medicine and hormone replacement therapy. She owns Aligned Wellness Clinic, specializing in hormone replacement therapy and metabolic health. Welcome, Angie. We are so glad that you're here with us.
Thank you. I'm happy to be here.
Angie, I'm excited to have you here because a couple weeks ago, as you know, we did a video on hormones that is very interesting to us women and the husbands who are wondering what on earth is going on with their wives. And you have
Yeah.
been a key player in my own well being and being able to come to you and share with you all the things that I was experiencing. I felt so validated. I felt understood. I felt like you have taken the time to really gather all the symptoms that I was experiencing before you just made a recommendation. And through our relationship, I feel like I'm getting my life back.
Mm.
I feel like my body is coming back to life again, feeling more like myself. And so I have so much gratitude for how much you have helped me. And I just love that you're here to help the rest of our audience as well.
Thank you. I'm very happy to hear that. It makes me it just fills my heart that I can help you with that and lots of other women. And that is, I feel like my purpose. So I'm very happy to
Yes.
hear that.
Well, you are needed and you're like a unicorn in the world of medicine,
Yes.
trying to find the right doctor to help us with our hormones is a needle in a haystack right now. And so I know that the things that you're going to share today are going to help the women so much, as well as the husbands know how do I support my wife during this time?
I have more to add to that because season five, episode nine is when we did the hormone episode, specifically where Adele and I were talking through this. We did some research, and I know you've watched that episode.
Yes.
And you're here to give us some more professional insight into that. But from a husband's standpoint, I want to thank you because as of January last year is when Adele and I were going through this season of trying to figure out what is going on in our life and in her body. And I was doing my own research. And as a husband, it is challenging to understand my wife and what's going on with her, to understand that she's normal and that what she's going through is normal. Because as a husband, I want to either blame or there's something wrong with me.
Right.
So I want to internalize me.
Maybe something wrong with my brain.
Yeah. And so I want to thank you as well because you've helped my wife in many different ways. And then now you're here to be able to bring insight and help to those that are going to watch this. And listen, everybody watching right now, stay with us. As we go through this interview, you're going to be able to see something for yourself. If you're a man, you need to be here.
Yep.
Don't tune out. This is great information for you as husbands and men because you have a woman in your life. And 100% of every person listening is impacted by hormones.
That's right.
And so I'm excited you're here. Thank you for being here. And I'm ready to dive in. I have lots of questions, so I don't know how you want to go about this, Adele,
Well,
but I'm ready to go.
let's start with how did you end up as a hormone specialist?
Well, I call it the conventional space or I worked in the hospital for a very long time and I was doing typical medicine, handing out prescriptions, doing all the things that we do in the hospital setting. And then 3 years ago, someone very close to me got a very scary diagnosis. And we were not given a whole lot of options other than here's this chemotherapy, here's this medicine, here's this radiation. And we weren't given a whole lot of support underneath. And I knew that there was more that I could do to help him stay healthy, help him feel better, help him get through this. And so I started doing all kinds of research and just dove into health. And I found functional medicine, which I had never been exposed to in my typical job. And functional medicine really is root cause medicine. And that's where the light bulb started going off for me because I realized I could actually help people. I could heal people. And I just couldn't stop reading about it and doing all the research and all the things. And about halfway through that training, I actually came upon hormones. And I have to say that I'm in that stage of life myself. I'm at 49 and was having some changes myself. And so when I started recognizing these things in myself and what I could do for other women and men, I take care of men also, adding in some hormones, it here I am. Like I said, I dove into it and I just decided that's what I needed to do and pivoted and started my own practice because I wasn't able to spend the time that I wanted to spend. And I was a little more constrained in the typical office hospital space. So I started my own practice and here I am.
That's amazing. And I love how your journey started with someone close to you. That's exactly how our journey started down this road of looking for core things that are going on to get healing, and ours is in a different realm of marriage. But I love that yours started with diving deep
Mm.
into looking at the root causes of why we're experiencing what we're experiencing.
You take it
Right.
more seriously that way.
Yes.
Yes.
And that's where passion, I think, comes from,
Yeah.
is there's something behind it. I'm not just learning this because I have to. I'm
Yeah.
learning this because I want to, and it's for me and the people around me that I love.
Right. Right. And that's definitely where it started for me. And I had, like I said, 20 years in the conventional, typical space. And I wasn't trained that way to begin with. I was trained more
Mm.
of put a band-aid on it. Let's give you some medicine to take care of, let's say, blood pressure, but it doesn't fix the blood pressure. So when I learned about root cause and there's a cause to everything that's happening in our body, I just feel like it's amazing what our bodies can do. And yes,
Mhm.
definitely a passion for me.
You may have just answered this, but I have a question around traditional medicine and functional medicine. And in your training and education, what have you found to be the biggest aha moment from traditional medicine to functional medicine?
I think just to keep it simply that there is a cause for the things that are happening in our body. And I wasn't trained that way in the conventional space. I was trained here is a symptom or here is a disease and here's a medication to, like I said, lower your blood pressure or lower your cholesterol, but not the why behind it. Why are these things happening? And like my the cancer diagnosis from my family member, there's a why behind that. And I was never trained that way. And so once I started to think that way, it opened up a whole new area of medicine for me that I can actually help people heal, not just put a band aid on it.
Amen. That's
Oh, it's
so
great.
refreshing because it's really made me not trust doctors when I go in and I share what's going on and they just want to throw medication at me. I'm like, no, that is not what I'm looking for. I want to avoid the medication because I want to heal so I don't have to be on medicine the rest of my life.
Right. And it's just a different way of thinking. I'm not blaming them at all. I did that type of medicine for a long time. And when you go to a typical medical program, whether it's, as a nurse practitioner or as a physician, um, that's the way you're trained. You're trained to diagnose a disease and give a medicine to alleviate the symptoms. And so it's all in
Yeah.
the training. And also when you're
Yeah.
in the typical you know, insurance space, I call it, it's very limiting. They're given a very few minutes per patient to figure out what's happening and why and move on. It's very fast paced. And that's just the way that medical model is set up. And so they're doing the best that they can with their time that they're given, but they're not given enough time. I'll just be honest, they're not given enough time and enough education this way.
Yeah, I want to share just a personal story for me. There was a season of my life where I ended up on 14 different prescription medications, and a good bit of those prescriptions were meant to help with symptoms that other medications I was taking was creating. And when I got through with that road, I discovered there was, like you were talking about in functional medicine, there was a way deeper root to what was going on with me, that if I were to have addressed that, I would not have needed the medication.
Right.
I needed healing in a different area of my life that I just was not looking at and no one was pointing to. Not that the medical people that were helping me were bad,
Right.
but like you said, they're very limited in their scope and their time. And this is my opinion. I'm throwing my opinion out because I'm not a medical professional. But my opinion is they do the best they have with what they have. And they're great for acute
Yes.
things
Yes.
and chronic issues. There's probably a deeper thing that we should look at.
Correct.
Now, that's
Yep.
my opinion.
I agree with you. That's my opinion also.
Okay. Okay.
So,
Yes.
so tell us a little bit about what you know when it comes to perimenopause and menopause, and let's just dive right in.
All right. So, perimenopause is a stage of life that can start late 30s to early 40s, typically starts about 10 years before actual menopause. And I like to think about it like reverse puberty. So, in puberty, everything is ramping up. In perimenopause, everything is sliding down. And that change causes many changes throughout our body. So, typically, what happens in that stage is your progesterone and your testosterone start to drop, but your estrogen stays higher and can actually fluctuate. It makes I always do a wave because it goes up and down throughout the beginning part of our cycle. Those up and downs are what cause our mood fluctuations, our sleep interruptions, our all the things that come along with, this stage of life. It can cause anxiety, it can cause, like I said, sleep disruptions, mood changes, and a lot of times women don't know what or why it's happening, and it comes off as just feeling more anxious or more short with their family, their children, their husbands. They're waking up at 3 a.m. and staring at the ceiling and can't go back to sleep and don't understand nothing else has changed in life. We're all busy. We're all, taking care of lots of things, but then all of a sudden our anxiety is through the roof and we can't figure out why. Or feeling very emotional and short and don't understand why. So that is what is happening. Our hormones are changing, and estrogen is, I like to call that our excitability hormone. So that's the one that we go up and down and up and down. And that's what makes us feel anxious and emotional. And progesterone is our calming hormone. So as that is dropping, then our sense of calm and our sleep is interrupted.
I'm very grateful as you share that. Obviously, I know women's symptoms are not the same from person to person,
Right.
but I'm very grateful that I haven't had the loss of control around emotions like a lot of women experience because I have in other stages of my life. And I think that's one of the only ones I didn't experience. But I imagine that is very confusing for everyone around and not being able to control, like, I'm happy now and then I'm sad the
Right.
next moment.
Right.
I did experience a lot of low moods that just kinda stuck around for no reason. I would tell him, like, "There's no reason to be sad or blah, and yet
Right.
there's nothing in me that's joyful and grateful and happy, but I want to be." Like, my heart feels that way, it's like my body can't translate it. Will you talk a little bit about the different kinds of symptoms and what you have seen really works in regards of addressing the root?
Yes. So, like I said earlier, I think the biggest things that I see right away are women come to me that they tell me that they're more anxious than normal. They're not sleeping well. And then, of course, when we're not sleeping well, that translates into other things in our life. More fatigue. I hear a lot that women are very fatigued, brain fog. They're not thinking as clearly as they did before. And I think the first things that we need to look at as far as root cause are foundational health issues. So, such as sleep, I mentioned that we need to get good restorative sleep. We need to try and reduce our stress levels. I know that's easier said than done, but making some time for ourselves, for prayer, for meditation, for calming ourselves, movement. We need to be exercising, and a lot of people are not making that a priority, but we definitely need exercise in our lives and nutrition. Nutrition, I should have actually said first, that would be one of the most important things. Whole, real foods are very, very
Amen.
important. Avoiding all the junk foods, I should say. And because those actually interrupt our hormones, they add to the chaos. And so we need to be making sure that we're getting good quality nutrients in our body in order to help our hormones with the balance. And some of these things can really make a big difference. Supplements to help with sleep. I tend to recommend magnesium at night that helps us relax. Melatonin is another good hormone to help us relax and see if we can get more quality sleep. And then at that point, if someone is still having symptoms that are, I call it interrupting their life, when it's making a change in your life, then I recommend seeking hormone therapy or, finding a provider that can help you with these things. But the first base layer is going to be those foundational health things: sleep, stress, nutrients, and exercise.
I, I love that you talk about that because my experience before you was none of those things were even asked about. Like, what is your lifestyle like? It was all symptom focused. And so that really stood out to me that you're looking at the whole well being. You're addressing everything to help. And if we don't have a solid foundation, we teach this in marriage. If there are cracks in there,
Right.
then eventually they're going to widen and they're going to cause more issues. So we have to have a solid foundation to build on. And once we have that foundation, then our well being and health can start to improve.
Correct.
And then you're saying adding in something like HRT for the breakthrough symptoms that are really causing issues is an added value and benefit that women can seek
Right.
out to get help with the extra symptoms that just aren't going away.
Correct. But if you don't have that good foundation, adding hormones to it is really not going to fix those pillars.
When you talked about these things that are going to be helpful, one was sleep. Is there a recommended amount of sleep, and is there a recommended way to do the sleep? Like, for instance, um, we also believe in healthy habits throughout the day, and we believe in going to bed at a particular time each night, waking up at a particular time each morning,
Mhm.
and getting a particular amount of sleep. And I'm curious, what would be your recommendation around sleep?
I recommend 8 hours. We
Okay.
need good, solid sleep to detox, to heal, all the things. So 8 hours. Women actually need a little bit more than men usually. But I use 8 hours as an average for both men and women. And just like you said, going to bed at the same time every night, waking up at the same time every morning, I like to encourage what I call sleep hygiene. So no caffeine in the evenings, no alcohol in the evenings, putting the screens down a couple of hours before bedtime because that can really stimulate our brain, the screens, even though we're just staring at it, it is actually waking us up. And a good dark sleep space, temperature controlled, and just making sure that you have a good, comfortable, quiet environment to sleep for 8 hours.
Great. Great. Thank you. And the next thing is nutrition. So you mentioned whole foods, I believe,
Yes,
versus processed foods.
correct.
Is there anything that stands out for you that, like, these 5 things, these 3 things, like, these are some major components that we should be eating, we should be going toward?
I like to encourage good quality meat. I am not really in favor of being a vegetarian at this, especially this stage of life, because I feel like we need the protein. I think that quality means a lot as far as our meats, grass fed, organic meats, if you can, and then whole fruits and vegetables. I think eating like our grandparents ate off the farm 100 years ago, right farm to table. I think we get the most nutrients that way. And like we said, staying away from the processed foods because the processed foods add to the chaos within our body because our body's not meant to um, digest all those chemicals. So I don't have an exact eat this, 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 and this, but I always aim at eating good quality
Yeah.
whole foods. Like I said, off the farm.
Good, good.
But I wanted to just say something about that because what I started doing was tracking and balancing protein, carbs, and fats. And when I started doing that, that's when I really started seeing the weight come off, my energy getting better, feeling better, because I was not getting enough protein.
Right.
I was getting like 25 grams a day because I don't love meat very much. I will eat it, but I really don't like to cook it. And so learning to cook the right amount of protein to go with the fats and the carbs has been huge
Right.
in how I'm feeling. Have you seen that as well?
Yes. And it's all in a balance. Everything as far as what we're eating and what's happening in our body, it's all in a balance. And each person is a little bit different. You might feel a little bit better with a little more protein and a little less, carb than I do. So I like each person to really educate themselves about what they're eating and how they're feeling. And you really can feel better quickly when you start eating the correct way. I had a younger patient a couple days ago just tell me that she started feeling so much better when she dropped the processed foods and she was
Mhm.
going gluten free, and she just said she couldn't believe how much better she felt. And so I think for some people it's just experimenting, seeing how you do with a little bit more protein, a little less carbs, or the other way around, and seeing what makes you feel best. But it's just very important to keep out the junk, the processed
Yeah.
stuff.
Sugar,
Yes.
inflammation.
Yes.
Or to tell on myself, yesterday I went and ate some gas station food and got food poisoning. And so I spent all day yesterday evening not feeling very well.
Yeah. Yeah, it's amazing how when you cheat a little bit and then you don't feel good afterwards, and yeah, it
Mm.
makes it not quite as appealing.
No, no, no. I had lots of inner dialogue telling myself that that won't happen again.
Good. You don't even need me to remind you about that.
Hey, can we go to exercise for a moment?
Yes. Yes, so
When you say exercise, go ahead.
yes. I was at this stage of life, and I'm aiming mostly at the perimenopausal to menopausal ladies at this stage, but um some weightlifting. I personally really enjoy Pilates. I think is a great for the mind as well as the body, but I do not encourage intense exercising. Like, I would not encourage somebody at this stage to go train for a marathon because that's actually a higher stress on our body than what people realize, I think. And sometimes those higher stress, like real high intensity CrossFit and, running for miles and miles and miles, that's actually an increased stress on our body. So I don't encourage those type of exercises. I do encourage strength training 2 to 3 times a week, add in some Pilates, that type of exercise, because it's great for our brain and for building muscle, because muscle is very important for our metabolism as well. But we don't want to increase our stress by overdoing it either. So again, balance. I'm going to keep saying that balance with everything that we do.
Balance. Yeah. Well, before we jump more into what is hormone replacement therapy, will you just talk to the men because we have had some men comment on that video saying, "Hey, men have hormone issues too. It's not just women."
Right.
So, will you address the issues that you see with men? And are the things that you're talking about, do they apply to that as well?
Yes.
Before you do that, I also wanted to bring in for me as a man, when you were mentioning a while ago that you felt this down and it's hard to access joy, that relates. I can relate to that. To where I have this downness that will come on, and I don't. I want joy. I want to be lively. I want to be active, but I'm not, and I have this where I feel down as well.
And I've noticed your energy is down
Low
too.
energy, yes.
So what happens with men as they age, their testosterone levels go down. So we all have the same hormones in our body, just in different ratios. So men are testosterone driven. And as we age, those testosterone levels go down. And along with it goes your energy, your mood, your motivation, your metabolism. So I do take care of men also. I help men with hormone replacement, TRT, testosterone replacement therapy, because as those levels decline in males, those are typical symptoms. So, like I said, lack of motivation, fatigue. I hear fatigue all the time. They have a hard time making it through their day. They don't want to do the exercises anymore. They've always been an active person, but all of a sudden, that motivation to do that is gone. And so that is replaceable as well for men. I do testing for men and um our your total testosterone levels are important, but another one that I always check on men are a free testosterone because total testosterone is like your gas tank, but your free testosterone is where your energy comes from. I do the same thing for my ladies. We are just running on a lower amount of testosterone, but both of those labs are very important when you're having your yearly labs done to look at both of those numbers because the free T is where your energy levels come from.
Where does libido come from? Is it total or free?
Free. I would say free is our more important because that's what we're using on a day to day basis. Total testosterone, again, is what's sitting in the tank, but your free is what you're using. So as that number drops, all of those things go down libido, energy levels, motivation, all the things that gave you your youthful vigor are now starting to slide down the
Mhm.
mountain a little bit.
I relate. That sounds like me. So thank you.
You're welcome. Yeah, I see that a lot in my guys. And it I think it's happening at a younger stage for a lot of males. Again, the our lifestyle factors, factor into that a good bit. And the again, the processed foods and things like that that we are taking in as younger individuals, both male and female, those interrupt our hormone patterns. So I see young men, I see early 30s that are coming to me that should be just full of life and vigor and don't feel like
Mm.
themselves. And so when I check their hormone levels are low already. And I believe it's lifestyle factors and things that are coming at us from what we're eating and our exercise and things like that.
That is interesting. So I've been diagnosed with low testosterone. It's been years, and I imagine it still is low. I have some concerns because one of the doctor who diagnosed me with that wanted to do shots or something that has to do with a needle, and I want nothing to do with that. But it makes me curious about something else that I want to bring up is statistically right now, uh, erectile dysfunction or ED, that right now there's an epidemic of the age being lowered for that around starting in the 40s. And my thought process was it has to do with pornography use, but maybe it also has to do with hormones. And you mentioned processed foods. Maybe it
Yeah.
has to do with those.
Yes. Well, our metabolic health is involves our hormone health as well. And so if we're not doing those, I keep talking about those foundations, the exercise, the eating healthy foods, the getting good sleep, all those things, it throws everything out of balance. And so whether you're,
Yeah.
30 and you're not taking good care of yourself, that starts to interrupt that balance. Or whether you're 50 and you are doing all the things, but as age comes on, then those numbers naturally decline. But I do think that outside factors such as nutrition and exercise and all those things can impair that balance even at 30.
Yeah.
Okay, so this is coming up for me, so I know it's going to come up for other wives listening
Yes.
because I hear this and I'm thinking, okay, if Travis were to get some HRT and his libido go up, like I already feel like my testosterone is not keeping up with his libido and I'm thinking about that being higher. What are some solutions to balancing between a husband and a wife when the libido isn't the same? Do you have any ideas around that?
Honestly, typically what I do is treat both people, both wife and husband,
Uh-huh.
because
Great
I
idea.
um I don't, the natural things can help, the exercise, I'll keep saying all these things, the nutrition, all the things, but I have a lot of couples that I take care of. So I'm doing the replacement for both sides. And it seems to really help marriages because we're getting back to a place
Right.
of equality, how we're feeling with libido and things like that. I don't know if that's really the answer you're looking for, but that's
Well,
what
I think that's great
I do a lot of
because
that.
then knowing that we're both seeing the same doctor who knows both of our health and can help us come to a place of where our libido is operating in the way that it should be at this stage, I think
Right.
is really helpful. Otherwise, I'm depending on the doctor or whoever he goes to, and there's no communication between the two. And so that can cause arguments between the marriage just in itself, or pressure,
Right.
feeling like the wife is under pressure, or maybe even the husband under pressure, because there's a lot of wives, their libido's higher than their husbands, especially if they're dealing with a low testosterone.
Correct. Yeah.
So
If the
I think
wives
that
are
is
getting
great.
the hormone replacement therapy and the husband's not, then yes, it can cause an imbalance that way also. I wanted to explain the difference between HRT and BHRT. These are, abbreviations that are being thrown around a lot.
Yes.
And HRT stands for hormone replacement therapy. That's kind of all encompassing. BHRT is bioidentical hormone replacement therapy. And that is the type of hormones that I prescribe. So that is identical to what is in our body, bioidentical, meaning estradiol and progesterone and then testosterone. I feel like it's very important to make that distinction because the not the bioidentical forms are the typical forms that you get from retail pharmacies aren't necessarily exact to what is in our body. They're considered synthetic hormones, and those can actually cause some problems and have been shown to cause problems. One of the things that you and I had that we were going to talk about, and I'll just jump forward, is the that the myth that hormone replacement therapy causes cancer. And there was a study that was put out, I want to say it was 2002, early 2000s, that scared everyone away from hormone replacement therapy
Right.
because it said that it caused cancer. Well, one thing that they did not explain very well was that the synthetic forms were the ones that were causing problems. So the progestins were causing problems, not progesterone, micronized progesterone. So I really like to educate people around those because the bioidentical forms do not increase our risk for cancers. And that's very important distinction, I feel like, so that people know what
Yes.
they're putting in their body.
I love that you explained that because it is important. And, the fact that they have never come back around with that study to say, hey, this is what was actually going on is such a disservice to women. I've done a lot of research on this, and that is not true. And so I love that you address that because people need to hear that.
I hear that all the time. Also, I have patients that are scared and I it's not to be feared. Bioidentical hormones are definitely safe, effective, and do not cause cancer.
Let's talk about menopause because we did not talk a lot about that in our first video. And we have quite a few women that follow our channel that are in the menopause stage. So they would like to know a little bit more about what they're experiencing and the risks if they do not do BHRT.
Yes. So the definition of menopause is to be without a cycle for 365 days. So once a woman has reached that stage, average age is 52, but it can happen as early, as late 40s on up. I've heard some women up to 59 are still cycling, but 1 year without a period is considered menopause. And at that stage, all of our hormones, so our estrogen goes along with the progesterone and testosterone. And those low levels then put us at increased risk for cardiovascular problems, for bone health. So that's when our risk for osteoporosis goes way up, our risk for dementia and Alzheimer's goes up. There's systemically lots and lots of things that happen for pretty much from head to toe, but then problems with sexual health come up, dryness, pain with sex, things like that. So that would really dampen, their sex life. And that is something that can be fixed pretty easily. So I do want to
Mhm.
encourage women to seek help rather than suffer quietly because there are things that we can do and it's not a very complicated thing either. Sometimes it's just some vaginal estrogen can really help with pain and things like that.
Well, and I'm curious about patients who are already having bone health issues, like brittle bones as they're aging, heart cardiovascular issues. I'm curious if you were to introduce hormone therapy, do you see that those symptoms and issues start to get better and resolve?
Yes. So especially with our bone health, estrogen is pro growth and it actually helps our osteoclasts and osteoblasts, which are our bone cells, to start producing more, and we can actually improve the quality and strength of our bones by adding an estrogen. This hormone replacement therapy is also anti-inflammatory, which helps us decrease our cardiovascular risks. High blood pressure a lot of times is an inflammatory response. So if we bring in an anti-inflammatory that can help with the blood pressure, decrease risk for strokes. And like I said, with dementia, one of the problems that they see, one of the root causes of dementia can be hormone related, like low estrogen levels. And so if we can replace those levels, we literally can help heal your brain.
Wow, that's just amazing to me because there are people that I know that are suffering with these things, and no doctor that they're seeing is even looking at hormones, not once.
I know. I know.
It's just so sad.
I agree. That's what I was going to say. It's sad. And, as women age, also, a lot of women die from UTIs. I didn't even bring up that. UTIs start to become an issue when we have pH changes down below and women start to have bladder infections, UTIs, urinary tract infections. Older women sometimes die from bladder infections, and all we would need to do is introduce vaginal estrogen. I mean, it's
Wow.
literally life-saving for some of these older women, and I don't understand why we're not, screaming this from the rooftops. I could talk about this for hours and hours, but sometimes it's just that simple that, we prevent UTIs and we might stop and someone that's older from getting really, really sick from a bladder infection. To me, that's amazing that it's that simple.
Well, talk about the difference between systemic hormones versus local.
So systemic just means that it's going throughout our body. And local is typically applied vaginally. And so it's only for those vaginal tissues. But systemic is either by mouth or topically on the skin that goes throughout our system. And there are a few times that we don't encourage women to do systemic therapy, such as like a breast cancer patient or something along those lines. But the vaginal hormone, the localized hormones are safe for pretty much everyone. I can't even really think of anyone that I would not prescribe those to. Maybe someone that had an active, like, uterine cancer or something along those lines. I wouldn't do it at that stage. But if someone has a history of that, it's perfectly safe. Many breast cancer patients, it's safe to do hormone therapy for. Testosterone and progesterone are both anti-cancer, actually. So I would provide those for any woman. And then the only thing that we might need to look a little further into as far as risks is it might estrogen systemically might not be as safe for somebody, but we can always do it locally.
And is it the systemic that helps with like the heart, the
Yes.
brain,
Yes.
things like that?
Yes.
Whereas local is helping with vaginal tissue,
Correct.
vaginal health, which also can cause, if you don't have that, UTIs and further
Correct.
complications that
Right.
could be a risk of loss of life.
Correct. Yes.
Okay. Thank you for explaining that, because I know that was a lot of the questions I was getting from women who know me personally reaching out. And I'm like, I don't know the answers to these, but I know Angie does. So let's talk a little bit about blood work because one of the things that I was told when I started this whole process is that no blood work can tell where your hormones are. And there's no way to figure that out. And so we just have to go on birth control and that will solve everything.
No, I don't agree. I like to do a blood panel on everybody, men and women, and I check things. I go a little further, so I check other foundational things such as vitamin D, I check your nutrient levels, I check your metabolic panels, and then I also check your hormone levels because that does give us a good starting point, I should say, to show us where those levels are at. And I believe that all of all of that blood work, each of our labs, there is an optimal level versus a normal level. Normal levels come from a very large panel of patients, both well and sick, and then they do an average and they give us a number. Well, I don't want to be compared to somebody that has lots of other issues, metabolic health issues. I want optimal. I want to know what the best numbers are. So that's what I'm aiming for when I do all that blood work is the optimal levels, and there are definitely optimal levels for our hormone levels.
Right. I think that's part of the confusion is when, like, let's say an OBGYN does a hormone panel, they'll say everything's normal. But what you're saying is just because it's in the normal range, which is also included with other women who have other health issues, so the normal might be low
Right.
for me, who's mostly healthy,
Correct.
that if I have optimal hormone levels, then I'm I have access to thriving.
Correct. Correct. And I don't like the throwing it all into the normal pile because, like I said, for example, I'm just thinking about like a male's testosterone level on a normal range. Normal is like 300, I think, 300 to 700, and optimal is 7 to 1100. I mean, that's a big
Wow.
difference, you know? So you go to
Yeah.
your regular doctor and they say, well, you're in the normal category. Well, 300 is not where somebody should be running from, running off of, but they're calling it normal.
I listened to a podcast by was a urologist who was talking about that they actually have lowered the normal range because so many people are unhealthy that is where most people are falling, which is why it is labeled as normal,
Yes.
which is not normal at all, and that's what you're saying as well.
Yeah, they're lowering these numbers as averages, but that doesn't mean that it's where it should be. It's just going off a large group population of patients, whether you're well or not. And then they average it and they say this is our normal range.
Yeah. Yeah, it's such a disservice to the public, both men and women who are seeking support to be told you're normal and fine, which is what I was told, knowing fully well I'm not normal or fine right now because I feel like I'm losing myself.
Right. And I
And I
hear
think
that
that's where a
that's
lot of people are.
I hear over and over and over again, I don't feel like myself. And that is I feel like that's dismissed a lot. But I listen to people when they tell me that. There's a reason women and men are saying, I don't feel like myself. I feel like we need to dive a little deeper and find that root cause that we've been talking about.
Hmm. Yeah.
I know that you're not a sexual intimacy expert. However, we do have older couples in their 70s, 80s that have sexual intimacy questions around hormones.
Yes.
Is there anything that you could give to them as advice or suggestions around their physical intimacy and as it relates to hormones?
I am of the school of thought that I don't think there's an age limit when it comes to hormone replacement therapy. What I'm providing the bioidentical hormone replacement therapy, I feel that it is safe. Me personally, I'll take it until my last breath because I feel like it's helping with aging. And so I would recommend hormone replacement therapy to pretty much everyone. And if especially older females, as we talked about, like the vaginal estrogen can be life changing. And that's really a simple, pretty cheap, pharmaceutical that they can get. And that makes a huge difference for females. And then with males, a lot of times erectile dysfunction is actually kind of a cue as to our metabolic health. So if you're having problems in that area, then it's probably time to look a little bit deeper as to your overall health and improving your overall health, because then that can improve as far as blood pressure, nutrition. I know I keep harping on nutrition, but it's so important. Nutrition, exercise, getting enough sleep, all those things can improve our sexual health for sure.
Is it ever too late? Like,
No,
I haven't had hormones and I'm in my 80s and it's too late for me.
nope, nope. I don't have anyone in their 80s, honestly, but I do have patients in their 70s, and I'm definitely improving their quality of life.
Yeah.
I'm curious for those that come to you that are on a lot of medication, do you help them like as they start this hormone therapy? Do you start helping them wean off medication, like specifically heart medication, blood pressure medication, thyroid medication, things like that?
I do tend to guide them back toward their primary care doctor, but it's pretty hard to argue when you go back to your primary care doctor and your blood pressure's better. They're going to want to take you off your medicine. And, as you're improving, they'll see the numbers and they'll agree with me. So I don't really manage that side of things. I wouldn't take someone off their blood pressure medicine. But as those numbers are improving, I would guide them back towards their primary care doctor to then say, hey, this is what my blood pressure has looked like over the past 2 weeks. And I don't think I need as much blood pressure medicine anymore. So again, empowering people and educating people as to, what their numbers should look like and what their levels should be. And then you can go to your doctor in a more educated, empowered way and say, hey, my cholesterol numbers look better because I've improved my diet and I'm doing hormone replacement therapy. Can we look at coming off my cholesterol medicine?
Okay, so one of the last questions is, will you talk a little bit about cost? Because I know for men, it's a little different than women, and it may be the same for what you do because you're independent. So will you talk a little bit about that?
Yes. So actually, both men and women, it's pretty similar. So I do a comprehensive consultation when patients first come to me. So I do a large, like I said, large lab panel testing from A to Z, checking everything in between, do that consultation. And then if needed, then I encourage hormone replacement therapy. And as far as the bioidentical hormones go, they are a little more costly. Insurance does not cover the compounded version. I like to encourage those because of there's not as many fillers and dyes and things like that in those compounded medications. And the medications usually run around $120 a month for women and usually around 65-ish for men. The way I handle things is a little bit different than some other providers. So I charge a fee for the visit and then I have the patients pay for their own medications. And so those are the costs typically that I see the patients paying for their compounded medication. So women, like I said, are usually around $120 a month for all three. And then males are usually around 65-ish per month for either topical testosterone. I do topical testosterone creams, and then I also do injections depending on what's best for the patient.
Okay, thank you for that. And for those that are like, I want to see Angie because she knows what she's talking about, describe your parameters and what you are able to help and support with for people who are out of state.
Sure. So I cannot write prescriptions out of South Carolina. I'm limited because that's where my medical license is, but I can act as a consultant in any state outside of South Carolina. So I can order the labs that I typically order for anyone in the United States and then do that consultation to give anyone, men or women, education about what their labs look like, what their optimal levels should be. I like to educate people about the optimal levels, not just normal levels, any nutrient deficiencies that I see, any anemia. I do uncover a lot of anemia for ladies that they don't even realize are there. So I can give supplement recommendations and education about what I feel like the next steps should be for people.
I love that about you that you're not just prescriptions, you're also recommending supplements that people can get over the counter that would really make a difference for where they are right now if they can't afford the hormones or something like
Right,
that. You have suggestions that can really help in the meantime, and I love that.
right.
How can people find you?
So alignedwellnessclinic.com is my website. And then I'm on both Facebook and Instagram. Facebook, Aligned Wellness Clinic. And then on Instagram, I Aligned Wellness Clinic I think it's aligned well underscore clinic. I'm trying to remember it. You can look up Angie Wetli. You can find me that way. Angie Wetli NP. I have 2 different Instagram accounts. Everything should be on my website and it's pretty easy. You can get on there and book a call with me. I do free calls all the time for people that have more questions. And then if you're ready to move forward with a consultation, you can just click the button there on the website. It's pretty easy. Takes you right where you need to be. And what I usually do is have people, I schedule their labs at a Quest laboratory anywhere close to their house. And I believe Quest is throughout the US. So I can put those orders in throughout any state. And then if you're close by in South Carolina, I can also do the prescribing for you if that's what we decide you need.
And I imagine you can also point people in the right direction of how to find the right person for them in your consultation, right?
Correct. A lot of functional medicine providers do what I do. I mean, literally, you could Google, functional medicine providers in my area or on Facebook, functional medicine, again, providers in my area, or you could even look up um, providers that specialize in BHRT, the bioidentical hormone replacement therapy. Or also, if you want to go the insurance route, I would just make sure that someone is a menopause specialist. So they've done that extra training and come at things, pretty similarly to what I do, but they can also use insurance. I don't use insurance in my clinic, but there are providers that do go through insurance if you need to go that route. But I would look up someone that is trained in that area. So a menopause specialist.
That I think is key, very important,
Yes.
because
Yes.
not everybody has the training. Just because they have training on vaginal health does not mean that their hormone health
Right.
has been included in that.
Right. I think I heard something crazy like in medical school, doctors only get like an hour of
Yes, that's
education
what I
around
read as well.
menopause. Yeah, or something along those lines. And I know I personally have taken a lot of extra education and courses, and not every, provider has done that. So I would seek out those people that have done that extra education and understand the why behind your symptoms. One of my purposes in life is educating people around their why, what is happening in their body, what we can do about it. A lot of times it's a pretty simple fix that you're normal, especially with the females that are having the emotional changes. This is normal and this is okay, and we can fix it. You're not losing yourself, you're not going crazy. So I just want to spread the word about the education surrounding hormones and all the things that it can do. And it can interrupt our lives, but we can fix that.
Thank you.
Amen.
Thank you. This has been a pleasure. It's so good to meet you. And thank you for all the information. I imagine that every single person listening or watching this is going to get a lot of value. Thank you,
Good.
Angie.
Good.
Yes, thank you for being here.
Of
I really
course.
enjoyed everything that you had to share, and I know it's gonna be a blessing.
Good. Thank you. Thank you for having me.
All right. Bye, everybody. Thank you for being here. And we will see you in the next episode.